Meeting?
1 second, we just need to broadcast, so we're official. So it's Zoom is communicating with YouTube, and so we should be going live in a couple seconds. All right, we're live. We're good to call the meeting to order, Madam Chair.
Good morning. Let's call our first meeting to order for 2021, January 20th. We have a quorum to meet. Roll call.
One second. Madam Chair, do we have anybody from Saratoga, Schenectady County on the line?
Oh, wait, actually, no. No, not yet.
All right, let me text Barbara to make sure she can get
Okay.
on. I was texting her
Thank you.
last night. Oh, here she comes. Speak of the devil. And I know Samantha Miller Herrera is also back from maternity leave, so she might be joining us. Although she had twins, so I'm sure she's very much
Really?
relieved
Oh
to
my
be back in the
goodness.
office.
Oh, I didn't know that.
Wow. I guess she can be excused.
Yeah,
That's a
if
lot.
there's not a better excuse than that, I don't know what.
All right, well, now with Barbara Morrow joining, we do have a quorum. We have representatives from each county.
Okay, thank you very much. Then we will start out by looking at the minutes from the December 16th, 2020 meeting. Any corrections or discussion on the minutes? Okay, I need a motion to approve.
So moved.
Second? Is there a second?
Oh, I think. Okay.
All right, all in favor? Aye.
Aye.
Any opposed? Okay, thank you. Next item on our agenda is the financial statements through December 31, 2020, and that's your memo 21-01. It's now on the screen. Thank you, Mark.
Your thing. We'll just go down to the financial statements. Lots of minutes. So you'll note the financial statements. We've booked revenues through 2 quarters. We're still waiting to finalize revenues for Q3 and Q4. Expenses are tracking pretty much to budget, which is a good thing. So expenses through December are estimated to be about 95%. So that's a good place to be. And the specialized secure detention is about 72%. So, we underperformed on the SSD budget primarily because in the beginning of the year we had less expenses, and it also took some time to staff up on the SSD side. So again, the financials represent revenues only through the first 2 quarters of the year, and expenses a pretty good estimate for the entire year. Any questions on the financials? I will mention that we are steps away from finalizing the 2017 and 2018 reconciliation and payments out to the counties. There's an adjustment to be made for 2019 payments, so I'm just working with that through our accountant. But after, 3 years, we'll finally be able to give the money back to the counties that we owe them shortly. So that's all I have in the financial statements.
Any questions of Mark on the financial statements? Need a motion to approve?
So moved. Warner.
And who's seconding? Thank you. All in favor? Aye.
Aye.
Any opposed?
Who seconded that?
Who seconded that, please?
Warner.
Steve. Okay, thank you.
Thank you. Okay, next item, we have the designation of bank signatures, resolution 012021. This is in your packet, notes, signatory number 1 is William Connors, the treasurer. Number 2, Marcus Stiglione, the executive director, and number 3, Amy Weinstock, the office manager. Need a motion to,
I will make one edit to the resolution just in case the bank officer is looking carefully, changing my title for this purpose to chief administrator from executive director. And that would be the only change to the resolution that I'll make.
okay. Do I need a motion to amend the resolution?
I think a motion to approve the amended resolution.
Yeah. So moved.
All right, second,
Second, Steve.
all in favor?
Aye.
Any opposed? Okay, thank you. You're all set
Okay.
with- Item number 5, 2021 budget amendment. Your attachment is 21-02.
So as we were in the process of putting together the 2020-2021 Raise the Age plans, and we were finalizing those, I remembered that the sheriff, Albany County Sheriff, is incurring costs as the co-administrator of the facility. So I asked where those expenses should be listed, and OCFS said that they should be included in CDYCI's budget. So it's not something that we've done previously, but rather than submitting the sheriff's costs into the Raise the Age plan, they're suggesting that we should include it as part of our operations expenses and, charge a proportionate share of the per diem rate. So that's the motivation to update the budget here. So basically, I've just added a new line for the Albany County Sheriff. They previously provided an estimate back in 2018 of what their costs could be. The $30,000 number, we may get to it, we may not. Things like their travel expenses to transport youth, their time to provide their oversight for safety and security as the co-administering agency would all be covered in that $30,000. And it's something that if they send us a bill, CDYCI would pay it, and then we include those expenses in the per diem rate. So that's what the proposed budget amendment is. Everything else is the same.
Thank you. Any questions, comments? Motion to approve that?
So moved.
Second,
I'll
Second.
second.
all in favor?
Aye.
Aye.
Any opposed? Thank you. Next item, number 6, approval of policies and procedures manual. That was a pretty large attachment, 21-03.
Yeah, if somebody was suffering from insomnia, it would have been a good,
101
really good
pages.
document to bring with you. Put it on your nightstand. But in all seriousness, this has been a document that has been a long time coming. It's as a policy and procedure manual, it is a living document. So as best practices are identified and incorporated into the manual, it will be continuously updated. But the process really began with the advent of Raise the Age, and the first director, Kareem Abdul-Mateen, first worked on it. Then Mr. Riccio worked on it, and Joe Mancini and Luke Jacobs are here to bring it over the finish line. But it was required that we develop new policies and procedures to govern the operations of the specialized secure detention facility in a manner that comported with the regulations that were promulgated that govern those facilities. And also, it was a good time to update a variety of things related to the overall operation of the facility that also applied to the secure detention facility. So I've asked Joe to hit the highlights, Joe and Luke to hit the highlights of the policies and procedures manual, pointing out things that maybe are new or substantially changed from how business operations happened previously. And I'm not sure, Joe or Luke, if you want me to share the policy and procedure manual, or you want to reference sections, or how do you want to do it?
I think we can just touch on some of the bigger things that came along with it. And Joe, you can jump into with anything you have. So a lot of the work went around with the SD. Had to go through OCFS and redo all of our policies to put them in a new format and to make sure that they were acceptable, which required a lot of changes, particularly with regards to things that we hadn't done before, such as good time behavior and how to work through that, which is not something we'd ever done before. So we
Can you
talked about
explain what good time behavior is?
Sure. Good time behaviors for our adolescent offenders who are sentenced with us, just like if they had gone previously to a correctional setting. If they follow the rules, they can have their sentence reduced. And that is not something we had ever dealt with before with our juvenile delinquents or juvenile offenders. So working in conjunction with the sheriff, they assist us with that, but we needed some policy with that. We did a lot of work with our medical unit because we beefed that up working with St. Peter's now, which gives us a lot more opportunity to work with youth, and we're able to do a lot of the things that we weren't able to do before. So that's currently in there. And a lot of things updating we had done because the manual hadn't been, over the past 23 years, hadn't had a lot of updating. So we had to update how we do searches and deal with contraband, how we do visitation, and how our case management program works and providing mental health, and also how our level system and how we provide incentives for the youth. So there's a lot of updating going on. And to be honest, Joe and I are in the process of re-updating right now, looking at all the things with a lot of the regulation changes with regards to how we have to change our restraints and have a much more therapeutic programming to move in that direction. So there's going to be a lot of changes in the next year that we've been working on. But this manual itself has been approved by OCFS and the OCFS legal department to say that it meets all the standards that OCFS requires, and so that we can keep our kids safe and our staff safe. Anything you want to add?
To echo that, the changes around when to engage in restraint and the elimination of prone restraints is something that we're working into. We have had some instances where we have let's look at not engaging in physical restraint, but it's really a way of us changing how we do things. So we want to do it in a way where we enhance programming and options available for the youth to hopefully keep them engaged. But it also, there's that balance of maintaining the order and the safety that we would interrupt behavior very quickly. And sometimes that doesn't land well on the policy or when OCFS looks at when a restraint happens. So we're taking a critical look at that. We're taking a critical look at our staffing. We have staffing that did not have the capabilities of doing a standing restraint for some of our AOs, our older AOs. Rather than bring them to the ground, it would be do a PRT and keep them up, or sitting to use mechanical restraints. So that's completely, that's going to take some shift for us and some different training and staffing patterns that we're working on as we speak. And we're developing a model that is going to work, where we can find a balance of keeping the safety and security of the facility, but also meeting the demands of OCFS and providing more opportunities for our AOs. Obviously, they're older and here for longer periods of time, so we want to have a more robust programming available for them. So we are moving into that as we continuously develop this model.
And as we make large revisions to the manual, we will bring it back to you for a review to make sure that everybody is on board.
And I do realize it was kind of hard to digest a 101-page document fully in 4 days. So if you have any questions after you dive into the document, please feel free to send them my way, and I can get them to Joe and Luke, and I'm sure they can provide you with an answer. According to the 4-county agreement, this board is responsible to adopt and approve policies and procedures that govern the operations of the facility. So this manual is presented here for that purpose. Luke mentioned that a lot of changes happened in the 20 years since it was originally developed. I'm just happy that it's now available as a Word document.
I am too. We can actually edit it now instead of having it photocopied.
When I originally started working on this, I talked to the office manager of the facility. I was like, "Can you email it to me?" She's like, "No, I can mail it to you." So big strides we've made here. So thank you,
Yes.
Luke, and thank you, Joe, for bringing it over the finish line. Any other questions?
Okay, no questions, and I'll call for a motion to approve the manual. Barbara, thank you. Is there a second?
Second, Steve.
Steve, second, thank you.
Second, yeah.
All those in favor? Aye.
Aye.
Any opposed? Thank you. I want to welcome Samantha, who has now joined us. Congratulations, welcome back.
Hi, thank you.
Okay, on item number 7 on our agenda is raise the age plan updates. I know Rensselaer County, we just redid and resubmitted our 2021, which only goes till the end of March. That was sent in. Mark?
Yeah, the state was a little behind on the 2020, 2021 raise the age plans. So they started this process again in, I think, November. So presented here on this little table are all the expenses that have yet to be approved in a raise the age plan, and they were submitted in this latest raise the age plan for approval so the counties can draw down and be reimbursed for their proportionate share. It includes a variety of security updates that were made back in 2019, but were not included in that raise the age plan, and also the current bedroom furniture project. And each county's share is there. We have billed, CDYC has billed the counties for all these security expenses, and we're finalizing the billings for the bedroom furniture expenses, but they will all be dispersible or reimbursable theoretically from the state once we send the bills. So that's just an update for you. No board action is needed.
Thank you very much. All right. Item number 8 in our agenda is the facility usage report, your attachment 21-04.
So this kind of tells the story of the last quarter of 2020. And you can see, as we all know, the majority of use was from the 4 counties. This Westchester youth was actually a trade from Albany County. So pretty much in Albany County counts towards Albany County's ratio. And, a small number of other youth using the facility. We had one request from an outside county to place a youth, when we were extremely full. We're continuing to try to work with OCFS as best as possible to take youth if our placement at our facility is critically needed. However, we are practicing, reserving some beds and holding open some beds for our 4 counties that have reserved them, so that we're not in a situation where we have to wait a significant amount of time for a bumping to happen, or the worst case scenario, there's nowhere to bump the youth. So by and large, the 4 counties are using their fair share of the beds. The population of the facility, I think, is down to 18 now, but we have been extremely full for the final 6 months of 2020. And we're still operating under a waiver whereby we can commingle the AOs, JDs, and JO populations as a response to the overall statewide capacity issue in the system. This daily operations chart, just shows the trends for the year. Obviously, increasing share of the AO population now exceeds the JD-JO population, corresponding to when we flipped the wings in July and August timeframe, and that trend sort of continues. Any questions about the facility use?
No questions. We'll move on to item number 9, update on COVID testing and vaccination.
So as a component of the intake process, the facility has a variety of screening questions that they ask youth And depending on how they answer them, they may ask for a test for the counties. As you recall, Berkshire developed a secure infectious disease action plan, which dictates the intake process for youth. And if youth answer a question that says yes, they may have been exposed to COVID, they go into quarantine within the facility. This new effort is really to make sure that we're administering tests to youth that come into the facility to, again, minimize the risk to the staff and to the facility, and also make it possible for the youth to be removed from quarantine much sooner than the 14-day guideline. And we've been thankful to work with Albany County. Thank you, Mike, and for helping out in the Albany County Executive's Office to assist the facility in ensuring that intakes that are generated from our 4 counties are tested for COVID-19 should they answer the screening questions in a certain manner where they would indicate that they should be tested. So that's definitely something that we're happy about. It provides another level of certainty for staff, and again, it enables the youth to be removed from quarantine quicker, and it also eliminates the prospect of transporting the youth out of the facility for testing, which is problematic on a number of levels. So we're very thankful to Albany County for assisting with that. And in terms of vaccination, early on in the process in December, November timeframe, the guidance from OCFS, had us sort of gearing up and waiting for, our medical staff to receive vaccination doses to make sure that the staff can be vaccinated. That didn't happen. So anyone in the counties who's familiar with how the vaccination process is going, it's a little bit haphazard. So facility staff have been left to their own devices and to find vaccination doses on level 1B. I know I sent a number of emails to the county folks last week, so we're trying to scrounge doses for facility staff. We have 50 staff, frontline staff at the facility, and they're not, directly county employees, but serve the county. So hopefully, as vaccines become available, we can reach out to our counties and maybe get on an accelerated timeline, but there's no guarantees. So Joe advised the staff to try to register through the state affiliated and state operated sites as soon as they can. And it looks like the soonest the staff were able to sort of make appointments was sometime in March. So just a request, if any county member or county employee, has anything that they can do, obviously I know there are not enough doses to go around for your employees, but just wanted to put a bug in your ear about it.
Yeah.
Anything
you, Mark.
else, Luke or?
Yeah, just a
Joe?
quick note. I did meet with OCFS on Friday concerning our youth in the facility at the current time, because one vaccine, Moderna, is only for above 16 and the other, Pfizer, is for above 18. At this point, OCFS is kind of waiting right now about vaccinating youth within the facility. It would only be a small portion of our population. There is concern that they could receive the first dose while they're in the facility, and then they would leave the facility and go home, and we could not guarantee them getting the second dose. So OCFS is looking at that. If some of these vaccines, the trials do go through and they are approved for younger ages, then we'll look more closely at the issue. But at the moment, we are not moving forward with any youth vaccines, and that's OCFS's stance at the current time.
Let me just chime in for a second. I'm still on the Capital Region BOCES board, and at our last meeting last week, we were informed that BOCES was able to get the vaccines for school nurses and occupational therapists, physical therapists, the people in education world that have direct contact with kids. And Mark, I'm wondering if, and Joseph Dragoni, our senior executive officer at BOCES, was the one who was able to, arrange for the vaccines. Maybe you could touch base with him, and because if we look at it as from the point of view of being a school, because kids are in there, they're in class, maybe we could get some help from BOCES or South Colony School District. to try
I
that.
will
rule.
ask, I will ask anybody, anything for any amount of doses. I don't care. I'm not beyond asking the governor for doses for the
Okay.
staff here. So I'll reach out to him and see if we can do anything about it. I know
mean,
the
I was-
nurse,
I was
the
thrilled
teachers in the
how quickly
facility,
they were able
the
to get.
teachers in the facility were able to access vaccines. And, I think, I don't know how, I really don't know enough about it, but I think the unions had some sort of allocation for frontline staff or teachers and things. And that's not something that really covers the situation at the facility, but I'll reach out to him, see if he's got any.
I'll just say I'm up to my eyeballs in this stuff, and the moral of the story is the supply just isn't there. I would love to say otherwise, but that's been our experience. So we request thousands and get hundreds, and that's kind of the way it goes.
Yeah.
I think we're in the same boat in Schenectady. We don't know what's coming in when, so we're having trouble monitoring and maintaining the appointments. Sometimes we have enough for everyone and extra, and sometimes we have none. So it's hard to figure out the logistics of it.
Yep. And the rules are very dynamic.
Yeah.
So last week we could vaccinate anybody that was 65 and older or any of the 1A, 1B essential worker populations. And this week we can't. This week we have to do just 1A and 1B essential workers. And if you're 65 and older, you need to go to a pharmacy, and that'll probably change next week.
Yeah.
Mark, it might be worth reaching out to one of the retail pharmacies to see if they could do a group vaccination. I don't think their vaccines have come in yet, but like Price Chopper is setting up for it. But it might be worth to reach out and see what they have. I mean, I'll check in over here and see if there's anything, any wiggle room, but I don't know if there is right now.
If each county would be willing to do their proportionate share, that means Albany would take 20, Schenectady would take 8, and Saratoga would take 4. But if anybody has any contacts of leads to follow up with, I know Joe Dragone, and I'll certainly try to find out a pathway for some of the retail pharmacies, see what's going on there. I was just up at 6 in the morning trying to get my parents a vaccine appointment in Florida and at Publix. The website was not operable for an hour, so I was just hitting refresh. But I got a text message. It looks like both of my parents just got appointments to get vaccinated in Fort Myers tomorrow. So good news for them.
Nice.
Are you advocating that we send folks to Florida?
Well, I
Florida,
mean,
there
if
we go.
we can if we can charter a plane for the staff, maybe we should do that.
Mark, are
All
we
right,
talking
sorry.
about only, we talking about for the staff only? Or are you also talking about vaccinations for the kids?
It's staff only at this point, based on the guidance from OCFS, because the vaccines are not rated or certified for individuals that are under 16 for one and under 18 for another.
Okay.
Yeah, I can't get my son vaccinated yet.
I got my parents' appointments through SUNY Albany's mass vaccination site the day that they announced the expansion, and they're scheduled for March 7th.
Oh, you're lucky. My parents are April 3rd and 4th, and they live in Manhattan, and they're coming up here to get it at SUNY.
I did hear that there's extra vaccine in Utica and Ithaca, if that makes any difference, that they're not
I
using.
almost drove to Utica for them for it.
Well, the trick is to go to places where people don't think the virus is real. They'll have extra vaccines. All right. Sorry to belabor the point, but that's the update on the testing and the vaccination. So facility operations report from Berkshire, Luke and Joe.
Go ahead.
Well, I think I touched on, we are working on a new program model at the same time, a new restraint model. Actually, Luke, we may have a funding opportunity where we would be able to expand our broadband capacity. That's a challenge for us in looking at expanding our program, is the connectivity. So we had a South County School District, Mr. Back has come over with a representative from the tech company they work with to look at our building to see what that would take. So we're going to put a budget together, and we'll also look at what are some vocational programming options. If we can broaden that capacity, then bring in some vocational options as well. So we can actually look into the possibility of having the youth with tablets that they can do their own work in their own rooms in the event that they're confined to the rooms. It'll give us that advanced capacity. We've also working to get Columbia Community College to do classes with us online. We have some youth that have graduated. So that's now an option for us. So I'm really excited about that. We have a new full-time rec specialist coming on that has a tremendous amount of experience with this population that will also help us with that programming with our older youth. And then we work, the other big one is the restraint, is getting prepared for the elimination of prone restraints. That's a significant change in how we do things. So we're working on gradually doing that, but at the same time maintaining our structure, because that works really well, but we have to loosen it up some. And I don't want it to get to where some other facilities have experienced an increase in youth violence and staff youth violence, that we do it in a way that works for us. But also present some better opportunities for the youth. So we're working on that. I think that's the big challenge that we have right now.
Thanks, Joe. Anything else or any questions for Joe or Lucas? Okay, is there any other business this morning? All right, it looks like our next Zoom meeting will be March the 17th. At 9 o'clock, and I know Amy will coordinate and get the message out on that.
Oh, yeah.
Okay.
Well, it's good to see everyone, and we'll see you on St.
Yeah,
Patrick's Day,
good to
right?
see you guys.
Yeah, that's right.
Need a motion
Everybody
to
wear
adjourn.
green.
Thanks, everybody.
Thank you.
Thank you.
Take care.
Bye, everyone.
Should we stay logged
We
Motion-
in?
need a motion to,
Motion to adjourn.
so
Right.
moved.
Craig and Barbara seconds.
All in favor? Aye.
Aye.
I assume everyone else is in favor because they already left.
Yes,
Thank you.
thank you. Okay, thanks, folks.
We can stay on, Mark?
Should we stay
Yeah,
logged
you can
in?
stay on.